Hey, my name is Chloe Green, and I'm going to be presenting the history and physical prognosis of my patient. So my patient's name is John Doe. He's a male. He was born on March 3rd of 1990, so that makes him 34 years old. He lives on 123 Burger King Road. And so he came in with his chief complaint that he had a sore that would continuously heal, but then it would reopen as time went on. And there was also an obvious growth on the skin that was abnormal. And so he came in to check that out. So for the history of the present illness that's going on, that sore had been around for about 6 months, and it just kept on healing and then healing and then opening, but it wouldn't completely heal, and it wasn't like it was scarring over. So it just kept on going back and forth. So when it was healed, obviously it wasn't, resolving itself like it would if you had a cut or a lesion or anything like that. When it wasn't healed, it would bleed or have pus coming out of it or something like that. And so he came in. It wasn't super bothersome to him. It was just kind of an annoyance. So when it was open, obviously when your skin's exposed, it's going to hurt a little more. So he rated that on the pain scale about a 5. And when it was closed, it was about a 3. So the only time that it really hurt him is if you applied pressure to it. It obviously looked a little irritated. He said he thought it was irritated because there was some redness around it. And he continuously applied over-the-counter medications like Neosporin to it to try and heal it, but nothing persisted like it should. He came in, and he said that when the bump first came, it was kind of a pearly white texture to it, and it just was convenient to come in today because he already had a derm appointment that he was well overdue for. So we were just going to check it all out. For the review of systems, we just went through a normal checklist of anything that may be cancerous. And so his neurology, there was nothing abnormal about that, nothing abnormal about his respiratory, and nothing abnormal about his cardio besides the high blood pressure that he already had. And also the skin, obviously there was a recurring sore and there was redness. As far as his past history goes, he has high blood pressure, and so he's treating that. But he's not on medication for it yet. It's just something that they're watching. And then for his family history, his mother died of pancreatic cancer, so that was something we needed to be kind of aware of. And then the only thing he was allergic to were non-steroidal and anti-inflammatory drugs, NSAIDs. As far as the physical examination goes, the patient's vital signs were great besides that already kind of high blood pressure, but nothing that was a red flag besides the sore. The sore was on his chest, and already looking at the rest of his chest was quite freckled, and so it looked like he had quite a bit of sun exposure there. And it turns out that the sore had an indentation in the middle and it had a raised edge, and so we biopsied it and everything like that, and it did have redness around it. And the biopsy came back, and it's not melanoma, but it was a little spout of skin cancer, and it was basal cell carcinoma. So as far as assessment goes and treating it, that area will be removed. We'll monitor that. He'll stay out of the sun. It's going to obviously be stitched back up. Luckily, we caught it early enough on that it doesn't require any major surgery. So now we're just shaving it off by excision. Yes. Shaving it off by excision. And then that area will just be evaluated constantly, making sure nothing else comes up. So that is all it for John Doe.